All right, so we are just about at 3 o'clock. And for those of you who happen to be signed on to the webinar earlier, yes, I did pop on and then completely disappear because I didn't realize it was still live. So sorry about doing that, but welcome to this afternoon Screenside Chat with CWD. I am today's awkward host, Kerri Sparling. I've been living with diabetes for 30 billion years. And I am really honored to be joined today by Dr. Bill Polonsky, who can wave from his cool office with the bulletin board and a printer. That's quality. So Bill, just to sort of kick things off, today we're going to be talking about managing diabetes during a pandemic, which is unique to so many of us. But I was going to read your bio unless you would like to present your bio on your own. But do you mind if I just give people a heads up on who you are?
I would probably say it in a sentence, but you can, how about if you, any part of that you want? I think reading the whole thing would be unnecessary.
Okay, well then I'll read the first sentence or two. So Dr. Bill Polonsky, who is sitting right over there, is Associate Clinical Professor in Psychiatry at the University of California, San Diego. He received his PhD in Clinical Psychology from Yale University and has served as Senior Psychologist at the Joslin Diabetes Center in Boston, faculty member at Harvard Medical School, and Chairman of the National Certification Board for Diabetes Educators. The bio is much longer. Bill, what's your favorite thing to do?
My favorite thing to do?
Mm-hmm.
Hiking in the mountains.
Okay, that was not included in your bio, but now it officially is. So thank you for joining us today. We're going to, like I said, be talking about diabetes during a pandemic. For those of you listening at home, please do put your questions in the chat because this is a rolling conversation. So as they come in the chat, we can address them here live, and Dr. Polonsky can kind of chat with you guys directly. So please do ask your questions in the chat, but I do have a couple for you, Bill, and I wanted to kick off with my new favorite phrase, which is something I thought I made up, but I don't think it is, about starting with the elephant in the Zoom, right?
Ooh,
Right, thanks. So I keep reading headlines about COVID and diabetes and how on paper in these news sources, I look like I'm gonna have a very tough go of it were I to get COVID. And it can be pretty overwhelming to read sort of that. So can you help us just by starting out with the truth to those headlines? Are we at a significantly higher risk than people without diabetes in terms of poor outcomes? And how can we reduce our risk?
Well, first of all, let's be clear. So I'm a diabetes psychologist. So you really shouldn't ask me. You should ask an endocrinologist with a ton of research background this question. So I will, of course, I won't stop me from telling you what I've read and what I know, but you should always take it with a grain of salt. So it is, and as you know, the evidence is changing day to day, right? We don't have very much, and you get something new tomorrow and then something else, and then they go, well, we haven't replicated that study. So I think we're really in a bit of an uncertain time. I think, as far as I understand, and again, I get surprised every time I pick up something new. If you have type 1 diabetes, I do not believe you're at any extra risk for running into COVID-19. That is my current belief, but I could be wrong. I think that's what I have read most recently. The real issue is if you get the virus, are you more at risk for something bad happening? And that's where people have heard about lots of evidence saying, oh man, diabetes is a terrible, terrible risk factor for running into serious complications. Of course, as we know, almost all of that evidence is about type 2 diabetes, not type 1. And I was just looking at a study published a few days ago that, and this was again, mostly type 2 diabetes, not all, but mostly. And they were saying, you know, actually even having an elevated A1C didn't seem to be related to your additional risk for running into problems, but being significantly overweight really did. And there were other factors, but about type 1, again, I'm kind of puzzled. I'd be hesitant to say whether what additional risk you might be at with type 1. I think the little I've seen seems to argue yes in one study, no in another. I don't think we know.
Got it. And I was looking at some interviews that you had done with Dr. Edelman over at TCOID, going back and forth about the risk factors. And like you're saying, the information changes every day, but the information is coming at us on a regular basis. And so it can really heighten the mental load of the stuff that we're dealing with as people with diabetes. And that's where we get into the mental health and the emotional health side of things. So with physical risk reduction comes that elevated mental health load, and diabetes is taking up more room than usual in people's heads. especially mine. I don't know if I'm unique in that way, but diabetes is a chronic condition, and COVID is starting to feel like it is forever. Like this is never going to go away, even though I know it will. But you can be crushed by that feeling of overwhelmed by living with this. So how could we help people who are living with diabetes mitigate that feeling of overwhelmed? What steps can people take to sort of reduce that feeling of stress?
Gosh, Kerri, I have no idea. I was hoping you were going to tell me that.
Oh, wait, I'm sorry. Supposed to be the guy who knows this one. So that one's coming back at you.
You know, I kind of want to answer some other questions first. I mean, I have my own I want to answer that I think I want to start with, if you don't mind.
Yeah, sure.
Because I've been thinking about this, and I want to say something. I'm curious what you think. I think if you're living with diabetes, especially type 1, we've talked about, are you at added risk? I think you actually come into the COVID-19 world with a huge advantage over a lot of people. That there's a real positive strength here that no one really talks about. If you've been living with type 1 diabetes and you've been even taking remotely decent care of yourself, what that means is you've gotten pretty good at saying it's important to address an invisible problem.
Oh, nice. Okay.
And most Americans suck at that. You know, like, and that's why we're seeing all these problems with, you know, Americans saying, you know, I'm free, I don't have to wear a mask, I don't know if I'm, you know, if it gets me, it gets me. I mean, they're not used to this idea that there's something invisible out there that's really worth your time and effort to pay attention to. So I'm following what you're saying. So on the one hand, yeah, it's an extra burden if you have diabetes, but we have to also understand it's sort of this odd strength in a funny way.
I like it.
Which is you're kind of prepared for this, and it's easy for you to recognize, like, oh yeah, something invisible could get me. Maybe I should address some energy in on this. That's worth it. Now, it can cripple you, right? You can be overwhelmed by that as well. But I just want to start with the fact, I congratulate everybody out there because you're coming into this with an extra strength I think a lot of people don't have. And when you look around, I'm sure you'll see that. Does that make sense to you?
Oh, it makes absolute sense. It's just, it's nice in a discussion about COVID to hear something viewed as a superpower. So diabetes, again, is being painted as something that's supposed to make us feel like we're supposed to lock ourselves in the closet and hide there. But to think that we have a set of strengths that other people might need to learn from us on is very empowering. So I kind of dig that as a Sunday takeaway. Yeah. Oh, and we've got some people in the chat also saying thank you. So this is not unique to me saying, oh, I didn't expect you to say that. Thanks for that.
Yeah, it needs to be shared, I think. I think everyone else needs to talk about that because this is a tough time. And I think we have to recognize at least that one thing.
Well, with that being our potential superpower, so how can we, if we're people, you know, I'm the one person in my house living with diabetes, and I'm the one person in our community, close knit, that's living with diabetes. So how do we pass on that ability to deal with something invisible in a powerful way to the folks around us who don't take it potentially seriously? Because it can be its own mental burden to be dealing with people who are like, yeah, no big deal. It's not a big deal when we know better.
Yeah. That I really don't know. I mean, you just have to slap them silly, right? It's just
you can't get that close to them. So
that's right, with a large 6-foot long slapping device. But no, I mean, believe me, we see that in our own neighborhoods all the time. I mean, that's our biggest challenge. You know, how do you know, there's a ton of research. I promise I won't go down this rabbit hole on what's called risk communication. You know, and how do people perceive risk, and to what degree do they. You know, it really comes down to any kind of positive behavior change. If you think about what you know about the benefits that are likely to accrue from making that positive change and the hassle involved in making that change, how do you balance those two things? And at the end of the day, you conclude from that, and often it's unconscious, that, you know, doing this thing, that's worth it. That's worthwhile. And so much of what we do, and we talk about diabetes, and it's true for COVID-19, is how do you hopefully get people to consider that making some positive behavior change, whether it's taking good care of your diabetes, whether it's making sure you don't miss any boluses, whether it means wearing a mask, that's worth it. And that doesn't mean just telling people that, because as you know, it's often people have very firmly held beliefs, but it's having that discussion. There's positives and negatives. How do you balance? How do you weigh those in such a way so that hopefully you'll believe what I think is true, which is it's probably worth it. Now, but what you're bringing up is another point, which is that, oh yeah, I think it's worth it, but it's easy just to get overwhelmed. You know, it's worth it to stay safe by never leaving my house. It's worth it to stay safe by trying to have perfect blood sugars, which is impossible. And that's how people drive themselves crazy, right? So now that's the rabbit hole you want to go down. I'm willing to do it. So I'll stop for a moment.
Well, I think it's because a lot of people are kind of down that rabbit hole because we've been dealing with this since the beginning of March as a country. And so a lot of people have been doing this for many, many weeks. And that impetus at the beginning to stay on top of everything and really make sure you're checking and just put that best foot forward, those efforts can start to get squashed by that feeling of burnout, not just from diabetes, but from dealing with the pandemic in general. So kind of keeping that hope alive and also that renewed sense of got to keep at it. I don't know what the clinical term is for that.
Yeah, you know, well, one of the things you and I have talked about before that I think is, again, it's a challenge when you have diabetes. That's why I think it's a strength if you're pulling this off, and it's related to COVID as well, is the toughest thing I think about diabetes is that you're being asked to put out all this effort and be vigilant. And we know that humans respond better to making positive behavior changes when there's some sort of short-term positive incentive. You know, I'll pay you to do this, right? And the funny, annoying thing about diabetes is that the reward, the incentive for taking great care of yourself over the course of years is nothing.
Right.
I mean, the goal is we want nothing bad to happen, right? I want you to run into no complications. And that's awesome. But it's, as human beings, we don't respond very well to that. Like, trust me, it'll be worth it because nothing bad will happen. And that's what we're dealing with COVID, right? It's sort of like, well, you know, be cautious, wash your hands, wear a mask, don't get too social, and nothing bad will happen. And that's a tough one for human beings. We like short-term incentives. That's why Las Vegas exists. You know, we're looking for that tangible payoff. So.
And it's not, and it's not visible. There's no vacation that comes at the end of this. You check your blood sugar every day, you get to go to Hawaii. It's like, really, wait, what? You don't?
Yeah.
That part sucks a bit. And then in addition to that, because we had already talked about the news and the headlines, it is endless. And I did see an interview with you recently, and again, this might have been with Dr. Edelman, about the endless news cycle and the need to turn off sometimes from reading all of that information, good or bad, facts or fictions, just having it come at you all the time. I mean, do you kind of stand by that it's okay to take a vacation from at least the news, the doom scroll?
Yeah, I think it's a great idea. In fact, I was just reading about, I mean, you may have seen this, someone was referring to that problem as panic scrolling. Like they're constantly looking, like what's new. And you just drive yourself insane, right? So yeah, taking a break from the news, good idea. It's probably all going to change tomorrow anyway. So just.
Yeah, I found for myself, if I didn't look at the news before I went to bed, I actually slept like a normal human being instead of we were calling it the doom scroll in our house. So it wasn't the panic scroll so much as just the scroll of doom where everything you looked at was like, and none of it was any good. People stopped sharing kitten and puppy photos, and I don't know why. They really need to get back to that, but it stopped, and it was a lot of stuff to make you nervous. And so you and
I could do puppy photos, so that's good.
We're known for our dog gifts, but I
do think I like the idea of calling it doom scrolling. I think that's actually way better, actually.
Well, because it kind of perpetuates that sense of, God, everything sucks. And so for people who are living with diabetes too, sometimes we get that doom scroll when it comes to going back through your CGM. Not that I'm speaking from personal experience, but you don't always get good feedback from that device either. And so from kind of your clinical expertise sort of way, how can people take some of this feedback that's so crummy sometimes and better address it, or at least face it?
Well, I think, and I guess I want to go back to that and your first question. You know, when we talk about just how how a lot of people are feeling these days, you know, we know a lot of people are just full of dread and anxiety, right? That's what you're talking about, doom scrolling. There's so much worry, and there's so much of it, we almost aren't even noticing it so much. It's sort of hanging out there in the background or above your head. And connected to that, there's a lot of mild and not so mild depression, right? So we heard, you know, Michelle Obama talking about that. And as psychologists, we know the single first thing we want to help people do is to label it and to normalize it. So just realize that if you're isolating yourself more than you need to, if you find that you know, you're so anxious you can't even concentrate your attention on anything, you can give it a label. Yeah, I'm anxious. Yeah, I'm full of dread. Yeah, I guess I'm getting kind of depressed. But also to normalize that, which is, honey, you ain't alone.
Yeah.
It's super common right now. And it doesn't mean you have to just stop. I mean, it doesn't mean that then there's nothing else you can do, but we have to start by just saying, welcome to a big boat. You know, this is tough.
But sometimes that boat too is sneaky and you don't realize you're floating around on it until you're way out to sea on it. And so are there ways for people to maybe like better identify those feelings? And we've talked about the rabbit hole quite a bit. And so, you know, when you're feeling super down, you don't realize how much it's affecting how you feel and who you are until you're way mired in the mud of it.
Yeah.
So what are some things that people can like say, oh, well, I can identify these habits or these things as potential signs of distress or depression or something I might just want to be noting?
Well, again, I go back to your, I'm going to keep saying it because I want to remember the idea of doom scrolling.
Hey, you're welcome, and I'm sorry all at the same time for that.
Yeah. When we think about the signs of mild depression, we often, it's funny to say this, but we talk about people isolating themselves, right? Which is kind of what we're kind of supposed to do, I think. But so it's, you know, when you're withdrawing from the people close to you in your life is often a warning sign, although that can be protective. When I'm just trying to think of the other minor things, certainly as you mentioned, when you're having trouble sleeping, it's often a warning sign. And that can be trouble falling asleep or staying asleep. You can notice, and this is again mixed up with what's going on because of COVID, when your eating changes, right? So some people find that they kind of lose interest in eating. Some people feel like they get a lot more interest in eating. And of course, all that's going to affect your ability to manage your diabetes as well. You know, there's some, I think, again, we see the evidence from all over the board. You know, we've seen some studies that because of COVID-19, a lot of people are doing better with their diabetes care.
I saw that.
Way better, right? Other people doing more poorly. So it really has to do with, are you able to, especially if you're unemployed or stuck at home, are you able to maintain some structure to your life? You know, if you're stuck at home and your kids are running around like maniacs, things can be chaotic. How do you have some structure? I'm sure that's not personal, Bill.
I feel attacked, but yeah.
But having daily structure is probably the most important thing. Having some structure, you know.
And so, do you want to like apply diabetes structure to that? You know, if you're making sure you're getting up at 7:30 every single day, making sure you're checking your blood sugar at 7:31 every single day, like that sort of, with those sort of habits, once they become baked in, at least help stave off some chaos?
Yeah, I think those can help a lot. I mean, you don't want to let the clock run your life as it can when you have diabetes, but hanging on to some structure is a good way to keep, not just help you to have good diabetes care, but help you to maintain your mood as well.
And so I've noticed in here locally, a lot of clinicians are now getting back to some in-person visits, but they're being a little choosy about what's coming in and what order they take things in. And so if somebody's looking for mental health assistance, they're often forced to take the telemedicine route because that's what's being offered at the moment. And so how do you establish, like if someone gets to the point where they say, okay, I really need to reach out to someone for this mental health help, how do they kind of establish that rapport with someone through this? Do you have any advice on that? Because I've gotten that question a lot from people in the community, and that can be a really tricky one. You're asked to be vulnerable through video.
Yeah. You know, I think it's doable. I've done it. It is, let's be clear though, it's not as good as human, let's sit in the same room, personal contact. It's just not as good. But I've had the opportunity to have Zoom relationships, therapy relationships with people, not a lot, but some, that we've managed to pull that off. But it takes extra effort on both of our sides to do that, right? And does it take more time? And maybe it takes more time, but it's all I can tell you, it is doable. It is, but let's be honest, it's more challenging.
So as a person with diabetes, if you are my clinician and I'm getting on a telehealth visit with you for the first time, what's some stuff that I can do to prepare to make that visit benefit both of us better? Accidental alliteration.
as a mental health professional or as a?
Yeah. So as a patient talking to a mental health professional, what can I bring to the table as a patient that makes, I don't know, making that connection easier?
Oh, a really good question. I don't, I wouldn't worry about it. Just
Oh, okay.
show up. Yeah.
That's enough for that outset?
Yeah. I mean, it'd be nice if you had a private place,
Mm-hmm.
right? So if we're talking and you feel comfortable that you're not being overheard.
Mm-hmm.
Um,
I am not that comfortable right now thinking I'm being overheard.
but
They just walked by.
you know, I think that's going to make it easier for you and for me. I would probably say that's probably the single most important thing.
Mm-hmm. So privacy for those conversations.
Absolutely.
Yeah. Actually did get a question from a psychotherapist in the Q&A. They were asking, as psychotherapists, how can we help enhance diabetes self-care during lockdown?
Oh, I want to make this more of a conversation. I want to ask them what they would do. I mean, how do we help them enhance? I
Renee,
mean,
if you can chime in.
no, I mean, it's the same thing. It's like, you know, helping, I'd say the single most important thing is helping people to retain some structure in your daily life. Even if your job has gone away, or you're working from home, or you've got kids, it's having that structure. That's the single most important thing. I think an additional thing is anything else we can do to make sure that we as the therapist aren't the only human contact they have.
Mm-hmm.
So we know that for anybody when they're trying to make and maintain positive behavior changes, it's nice to have people in your life who care about you and are rooting for you, right?
Mm-hmm.
So just maintaining any kind of regular contact is good. Certainly in the work that I do, I'm a big believer, as you and I have talked about, in terms of the bang for your buck idea, so that there's a gazillion things you probably should be doing to take good care of your diabetes. But maybe you and I could focus on one that you feel you're struggling with, that you think is challenging or doable, that we can address, and where it's actually likely to be of some value.
Mm-hmm.
And so, and I might help you pick that, right? So if you have type 1 diabetes and you're struggling, you know, the first couple of things we're going to probably want to talk about is, you know, are you bolusing right? Are you missing a lot of boluses?
Mm-hmm.
Are you, I mean, that's in terms of glycemic benefit. That's not necessarily a mental health benefit. I guess that's wearing my educator hat. And, you know, people are making other food choices now, right, in the midst of the pandemic, maybe because they're seeking comfort. We don't tend to go for carrot sticks when we're seeking comfort.
You can't bake those.
You
so
can't,
that's what makes it trickier.
probably not, yeah.
No.
But those sorts of things, we can talk more about that, but those are the kind of things that come to mind.
Mm-hmm. And yes. Oh, okay. She's chimed back in. She said, yes, starting a conversation. And then physical activity is the most challenging part for her clients in lockdown. And I know that you've referenced that before too. The whole staying active can make you feel better mentally, but it can be a challenge finding the space and the time, especially in a very tight lockdown situation, to have that ability to kind of take some time for yourself.
Yeah. And as this person knows who was just asking, I mean, we have tons of good evidence that regular physical activity isn't just obviously great if done well, wisely, for your diabetes. It is probably one of our most powerful antidepressants. Mm-hmm. Odds are, for most people, it's going to work just as well as an antidepressant medication. Not that you should quit your antidepressants if you're on them, by the way, but regular physical activity is a powerful antidepressant. I don't know. I mean, I don't have any glib, easy answer for the variety of situations people are in these days. I think for a lot of people, it means finding new types of activities and being able and willing to try them. And when we're creatures of habit, that's hard. You know, for me, for my life, I have gone to a gym every day until 5 months ago. So for me, it was a big challenge to go, well, what do you mean I can't go to a gym? Maybe ever, you know, or from the end of the year. What else can I do given whatever the constraints I have in my neighborhood or around, or what my governor tells me? Mm-hmm. So it's, you know, can you try something new and what's possible for you? And again, that's uncomfortable for folks, especially right now.
Well, I was thinking about, I can't help but apply these things to my own house. And so some of the things that I need, my family, I have my husband and our 2 small kids. We have a almost 4-year-old and a 10-year-old. Integrating this mental health boosting sort of stuff into our regular activity. And so my son, who's almost 4, has been watching The Floor is Lava on Netflix. I don't know if anyone has watched that out there. Bill, I don't know if you've watched it either. But
What's it called?
the floor is lava. And it's exactly what it sounds like. People are going through an obstacle course where they pretend the floor is lava, similar to how kids take all the couch cushions off the couch and jump all over them, pretending that the floor is lava. That has become the physical activity sometimes for my family as we jump from cushion to cushion. We had to be really flexible with that. But redefining what exercise is in this house has helped a lot, whether it's the floor is lava, whether it's gardening, which I thought was going to be boring and for old people, but maybe I'm a boring old person. That's become, you know, something that I'm into as well. My husband has built a gym in our garage, similar to you. He goes to the gym all the time, but hasn't been able to for months. We had to make it fit in our house, but we had to have a conversation between the human beings in the house to see what we all could do together, because parsing off hours and hours on end to do so much self-care is difficult when you have, and at least here, small kids in the house. So it was a family conversation.
And the key to what you're saying, and maybe we'll get some other great ideas from the people who are watching right now, is again, we have to get incredibly creative. This is the time in life, man. It's time to try something crazy new. And we're all struggling with that, right?
So when your gym closed, what was your crazy, I mean, do you ride a unicycle now? Like, what did you do? Do you?
Unicycle. See, that's a creative idea I hadn't thought about. So I am just now walking a ton, and doing some hiking and some biking when it's possible, allowed to do that. I've set some things up at home, probably not as fancy as your husband has done, but mostly I am wearing my legs out. I'm just walking crazy amounts outside as much as I can.
And that's what's recommended around here too. Our governor has things pretty quiet. So that's what we're seeing a lot of people doing. But going back to like the family dynamic, are there, in thinking of, because a lot of people are locked in with other people or in quarantine pods or bubbles with other people and families. And so what kind of questions going back to the diabetes stuff, can people with diabetes maybe want to be asked by those people? Like, what questions might be helpful for a person with diabetes to be asked by that spouse or that partner or that friend that can be supportive? Because you had mentioned earlier about making sure that maybe the mental health professional isn't the only person that we're coming into contact with. Like, how can we build that support network and make it clear what we could use?
I think if your partner just says to you a lot, "Are you low? Are you low? Are you low?" No, just kidding. Don't do that.
That never goes well.
Don't ask that question. I don't know. I mean, the only thing we ever tell, in all the work that we've done, and you and I have done, when we talk to partners and family members, we say the single most important thing you can do is you can ask. Tell me what do you need? I would like to be able to support you with dealing with the job of diabetes. How can I be helpful? And maybe that means hanging out with you if you're going to be checking your sugars and being upset about that. Or it can be, how about if we all, speaking of being creative, try some different kinds of, not overly high carbohydrate meals. Maybe we could do, but let's get creative. But most importantly, it's don't mind read that you think you know what's needed. You could ask. I should mention, we have a new research publication, I think I may have told you about this, that hopefully will be out soon, where we looked at if you have CGM, if you have a Dexcom, and you are sharing with your significant others, what's the best way to use that? So I imagine your husband probably some of the time has your data he's looking at. Maybe not right now, but on occasion.
Well, when I was traveling, he looked all the time. Now that we're in the house together and no one is traveling for work of any kind, everyone hears me beep. So I feel like everyone in my house is sharing my CGM data if it's audible.
Okay.
So that dynamic has changed a little bit.
So, but what we found when people were actively using Sure, they found that what people enjoyed the most or appreciated the most and had the biggest effect on them is, first of all, having a conversation about, if you think I'm going low or you think I'm too high, whatever it is, let's have some rules of the road, kind of what you're talking about, over what you, the partner or significant other or parent, what you should do at that time and what's okay with me if you do at that time and what I'm going to do at that time. Let's have an out loud discussion about that. And that turns out to be really powerful. It doesn't happen enough. We just kind of make assumptions that we think we know what the other party should be doing and don't ever talk about it. So I mean, finding a nice, quiet, dispassionate moment to have that conversation can really matter a lot.
And also to not be low in that moment when you're having the discussion is probably pretty helpful too.
Exactly.
There we go. But actually, you and I have talked about CGM etiquette quite a bit, and how, what kind of conversation, what kind of questions should be asked as you're kind of laying down the law about how you want people to react. And that has come home to roost for me now that we're all here in this house, because when my low alarm comes off, my husband reacts to that. When my high alarm goes off, I swear to God, he just whistles and walks by because he knows I don't want any commentary. And it's interesting to hear and see that kind of play out live.
Yeah, I still remember one of the things that, I don't know if you, when you wrote something about this, or whether you told me this, or whether someone told you this, but it always stuck in my head that the single most important thing not to do, if you hear my low alarm or high alarm go off, is to ever ask me why.
Oh, I felt my pupils dilate right then, sorry.
But that's always stuck with me. Don't ask me why. Why are you low? Why are you low? What did you do wrong? Right? Not useful.
No.
Unless you think it's useful in some way now.
No, I haven't changed my mind on that at all. Why are you low? I have diabetes. Why are you high? I have diabetes. Like, it feels like it's going to be the same answer, but it's the source of frustration, and to ask is just going to make it worse.
Right. Don't ask.
No, unless the answer is like just straight out cheesecake. And that is an acceptable answer sometimes. But trying to think of other sort of questions that we had that were related to COVID. And we've got a lot of commentary coming in from folks.
Good.
Oh, I have somebody asked about, well, what do you think of weighted blankets?
I
didn't expect that question. I like it. I personally find them calming, but I'm not the clinician in this discussion.
I've heard that they can be of value and use for many people, but I don't. Sounds okay. Not out of my area of expertise. That's what I would say.
As long as it's not too heavy, right? That would become problematic.
We have to be very, one of the things I feel like we don't hear enough from healthcare providers is we don't hear the 3 words, I don't know. You know, since you're supposed to be an expert, it feels sometimes uncomfortable to say, wow, that's not in my area of knowledge or expertise. Maybe we could find out together or something, but I don't know.
I find that comforting. I find when somebody says that they don't know something, it reassures me that they shouldn't. Like, you can't be a subject expert in every single aspect of everything.
Yeah, we could pretend, but that's exhausting.
And it could be terrifying if you actually don't know and you're trying to pretend that you do. So
yeah,
I appreciate that. And it also helps reduce anxiety when it comes to discussions. I don't expect people to be giving me information where they're just kind of spitballing.
Yeah, I mean, even this whole discussion really is to some degree. I don't know. I mean, I'm going to give you the best answers I can, but in truth, I have not written a book, nor can I, about how to be happy with diabetes during COVID-19. I mean, we are all figuring this out, limping along together, trying to make this happen. And that's why I think what you're doing with these conversations is so wonderful.
Well, I'm glad that you're part of them. And that, talking about that part of it too is kind of intense, because there is not a manual on how to manage a pandemic and diabetes. Maybe there will be, like you said, afterwards, but there's not now. And so there's a lot of anxiety associated with the fact that every single one of us, clinicians, patients, public health, the whole bit, we are figuring this out as we go. And that can create a lot of anxiety. And so from a clinical perspective, how can people acknowledge, address, face some of that anxiety, knowing that everyone else is dealing with it? What are some ways that people can maybe reduce that feeling of anxiety? Like, knowing that you will not pretend to know an answer is helpful for me, reduces my anxiety.
Yeah.
When people are vulnerable about what they don't know, that does help. Like, what are some ways though that people with diabetes can help take a bite out of that anxious feeling?
You mean the sort of dread and anxiety everyone's feeling?
Yeah.
So, I mean, at times like this, I have to fall back on what I've learned over the years. So, we know, I guess let me say something incredibly obvious, but it's important.
Okay.
That anxiety is in 99% of the cases about the future, right? What we all were worried about, we're not really worried about, am I wearing pants now or something? We're worried about what's going to happen if someone notices I'm not wearing pants or something like that. I am wearing pants, by the way.
So am I.
It's almost always about the future. And when we don't know what's going to happen, we can start this process of ruminating, right? What's going to happen? What's going to happen? I don't know. What's going to happen? What's going to happen? And we kind of go over and over and over again. So, what do we do to stop that rumination when there is no answer, right? When there is no, maybe we can do a couple things.
Okay.
I think about the questions you asked me. One is to figure out, well, what is my risk? Am I at much risk as I am concerned I might be? We don't know, but the answer is probably odds are good you're less at risk than you think you are, maybe. And how do you, we ruminate when we have nothing else to do. So and here you are maybe stuck at home, you're not in your normal job, maybe you had to put aside many of your hobbies. So the rumination that goes around and around and around is often because we're almost bored. So what else can you do that will take that place? So when you say, well, we're talking about doom scrolling, it's one thing to say, well, just stop. Well, it's like, well, wait a minute, what do I do instead?
Right.
So, maybe it's walking in lava. What is it?
The floor is lava, Bill.
The floor is lava. You
don't want to walk on it.
Yeah, let's make up a new game. Let's find a new hobby. Let's do something else. I think nowadays the most valuable thing you can do is how can I help somebody else?
Okay.
What do my neighbors need? And can I offer them any help? I think the most valuable and powerful way that you can feel better is thinking about what can I do for somebody else.
Oh, I love that.
And again, it doesn't make all the worrying go away, but it gives you something else to do. And again, just think about this brain process of it's just going like this around and around and around, and you have to interrupt it. You interrupt it with exercise. You interrupt it with finding something else to do. Most traditionally in terms of as psychologists, we talk about doing stress reduction exercises. So there's a million apps now that can teach you mindfulness meditation, for example, a wonderful thing to be doing. You mentioned gardening. You need to find some other way to feel potentially useful in the world right now, or something that's you're going to find valuable. I'm going to go on and tell you one more thing about that.
Yeah, sure.
Also underlying anxiety, underlying depression, similarly, is a feeling of powerlessness. So for anybody who's ever gone through a period of really being depressed, usually what it is, at least the psychological part of powerlessness, often there's a biological part, but the psychological part is, I feel like bad things are happening to me, and I feel like there's nothing I can do about it. And it's that core of powerlessness that really is critical. So how do we address powerlessness? We spend a lot of time helping people think, how do you regain some sense of power or control in your life, right? So that might mean helping somebody else. It might be one aspect of my diabetes can I feel some control over. Not going to feel control over a lot of things, let's face it right now. There's an old standby we used to say, which is, go rearrange the socks in your sock drawer.
Okay.
Anything to, find a new drawer for your, your kitchenware. I mean, you want to regain some sense of control over some aspect of your life. And it seems, I'm speaking of tiny things, but those really can make a difference.
I can't tell you how much time I've spent addressing the 3 tomato plants on my deck. An inordinate amount of time to make sure that they're fine and well cared for. And I mean, everything else could be in complete shambles, but I'm like, the tomatoes must be tended to. And it has been a nice focus point because it has nothing to do with diabetes. It has nothing to do with COVID. Yeah. We're going to eat all of those tomatoes in one sitting. There's probably like 6 of them in total. We're just going to house them. But it is a nice distraction and something to focus on. And maybe if we're feeling generous, we'll toss one over the fence to our neighbors. Helping our neighbors, it all comes full circle. But
don't toss it too hard.
No, because they just power wash their house, as I told you at the beginning of this. So I'm not going to chuck that thing too hard. But the idea too of helping other people. So a lot of times people right now are staying isolated and not getting out into their communities. But the diabetes community in particular is really coalescing, and we're doing a whole lot of stuff online. For example, these Screenside Chats, all these virtual conferences, people are really taking to the internet to connect with their peers. And it seems like a lot of people, because you've already mentioned having lost jobs and whatever else, that there are a lot of opportunities to help people, whether they need someone to tell their story to, they need some resources on getting access to insulin or device supplies or that sort of stuff during these particularly odd times. There are places where people need help, and there are people who can give back in that way. And I love that you suggested helping people. That's a huge thing.
Yeah. Yeah. If you have the energy, it's wonderful. I mean, the littlest things in the world can matter, right?
Mm-hmm. It does make a huge difference. And so when you're walking around your neighborhood, are you looking at people wondering who you can help? Just shouting pearls of wisdom from your stroll? I don't know what you do when you walk.
We try to have regular cocktail hours with our neighbor, who's an older lady who lives by herself.
Mm-hmm.
We worry about her being isolated. So that's one thing we can do. When I walk around the neighborhood, I try really hard to say hello, since people can't see me smile.
Mm-hmm.
I feel like I'm not the only one who's doing this. I want our neighborhood to feel like a neighborhood still,
mm-hmm.
even though we're being so much more cautious.
Sure.
So, but now you make me feel bad, because I'm not doing anything more than that, actually, as I think about walking around.
It's not to put a burden on you, but I mean,
you're going to be creative and give me other ideas on this.
I'm going to send you one small sad tomato, and that's going to be the way that I give back. It's going to be FedExed and squished.
Well, I wonder how many people who are watching right now, myself included, I can sort of see out of the corner of my eye our tomato plants.
Mm-hmm. Mm-hmm.
And so I know exactly what you're talking about.
And I'm looking in the chat here, and I'm seeing a lot of people talking about doing training for their virtual rides and training for their the ADA and the JDRF and those sorts of fundraising opportunities, and doing these things virtually. So there are so many virtual things, but it is easy to get burnt out on those things too. So I don't know if you have any advice on how to manage Zoom burnout or virtual everything burnout, but do you have any insight on that? Have you heard that people are just so tired of sitting in front of a computer? Please don't leave, by the way, everyone who's still sitting. Give us just a few more minutes. But I mean, because this becomes, repetitive and that kind of stuff. So how do you kind of break it up?
Yeah. I'm not sure I figured that one out either, but because oftentimes, perhaps like you, I'm on Zoom calls all day long. Mm-hmm. And occasionally someone will say to me, someone I know will say, well, let's just have a phone call. And it's like, a phone call? Such an odd concept, like a phone call. And they will remind me that, then I can just sort of hang out and walk around, and I don't feel like I'm stuck here with my computer. It feels more comfortable to be able to wander and do things. Mm-hmm. So I can appreciate the Zoom burnout. I've certainly experienced a lot. I'm thinking how many times I've had healthcare systems say, oh, we really want you to come. It's happened so much in the past few months. We want you to come do like a 4-hour program for us virtually. And I keep saying, no one's going to pay attention for 4 hours. That's insane. I don't want to do a 4 hour. I could do it, right? I'm happy just to jabber on. But believe me, that's a terrible idea. We all get really, really tired of this. What have you found that works?
Honestly, the phone call thing is amazing, because when people are like, do you want to schedule a Zoom? I'm like, I don't actually. I would like to call you or send you a telegraph, and that's how we'll communicate. I found that my children are, they've found pen pals, so the kids that they used to see in school, they're now mailing letters back and forth because, making sure the Postal Service keeps doing their job. But it's been kind of nice to go back to those smaller, less screen style moments of connection. And when you had talked about too, the calming apps and the different meditation apps, are there things that exist that do not involve screens, where people can take that mindfulness and that sort of calming aspect and either have it through? Do you have any podcasts that you would recommend, or just something that doesn't involve having to listen or view? It kind of reduces the screen time. Yeah,
no, I don't, nothing comes to mind. I actually recently went through a whole bunch of meditation apps to see which ones I could recommend. I wasn't really keen on any of them. They were either complex, or there's a couple that are get a little costly that can be good. I just was trying to find some that are inexpensive or free though. I haven't really run across anything I'm too crazy about yet.
Mm-hmm.
Maybe there's some of the people watching have run into some of those, but I'm looking for them myself, to tell you the truth.
Someone
Back
in
to
the chat just said we could read a book. Good suggestion.
well, I think many
Books
great
and phone calls, that's why.
I know great meditation books. That's easy. But you know, one thing I want to mention, I'm thinking about what you said about Zoom though, and I think it's because even if it's just a private Zoom call, just you and me, there is some performance pressure.
Yep.
You know, that I know I am, probably you, I always feel to some extent when it's a video call. Almost always, unless it's like my best friend, you know, and if it's on the phone, I can just lie around and pick my nose and whatever. Yes. There's something a lot, it's just much more comfortable. And I haven't really seen any way on a Zoom call for me to feel that level of comfort. And there might be something to do, but I haven't discovered it yet.
Other than turning off the video, yeah. No, I haven't. There is that performative sort of thing, and that can be stressful. And going back to telemedicine too, that can be weird for patients who are sitting on the other side of a screen when you're trying to let your clinician know, yes, I am paying attention, yes, I am trying my best, but you feel your posture go and you're just like, oh, and you just feel like a human garbage can, and they can see you doing that through the screen. So it gets a little awkward in that, on the telemedicine sort of side of things too.
Yeah, that's a really good point.
Because, you know, you have that, especially I've only had one visit with my endo since COVID started, but it was over the phone and it wasn't through video. And I'm afraid that if he and I had a face-to-face sort of chat, that the whole thing would just like fizzle out after 6 seconds after I asked for a refill of my prescriptions. You know what I mean? It doesn't have the same sort of ease of use.
Yeah, you have to have your list of questions, your list of things. Here's my 10 things I want to make sure we talk about. Here's my list.
Well, that's kind of why I asked about the appointments. If you're sitting with a mental health professional, having that first visit, it can be really difficult to say what's bothering you the most with someone that you're just getting to know, never mind getting to know them through Zoom. And so I know a couple of different organizations that have made conversation cards where it almost says the concern for you, and you can either slide it across the table or, in our circumstance, you know, hold it up to the screen and say, this is my concern. But I think in the diabetes community, that would be something that would be really interesting to put forward, just a conversation starters. What's bothering you the most? What can't you say out loud, but you can hold up the card that illustrates your concerns?
I don't know, if you're a good therapist, why would you want your client to need that or have that?
Not so much for a therapy appointment, but potentially for like an endocrinology appointment or something that's slightly more transactional. Like, I have a concern about my blood pressure. I'm concerned about my access to the prescriptions that I need, like those sorts of things. People are all keyed up about all kinds of stuff.
Well, you know, even, I mean, it's, you know, we've been, as you know, we've been pushing this in terms of live visits forever. Anytime you see your endo or any doctor, you should have a list. You should walk in with a list of, you know, 4, 5, 6 things. And they can be, here's the questions I want to make sure I get addressed. Here's some concerns I want to make sure that we talk about. I mean, that needs to be a written list. And I feel that way for myself as well. And people say, oh, I'm not worried about it, I have it in my head. But you just get too flustered. You know, you show up and there's things running around and time's limited and people are going, it can just disappear. And having that written list is really powerful. And it's often incredibly respectful to do that as well. It's good for everybody. So I like to, you know, have a list, show it, here's my list. If you want to really freak out your healthcare provider, you know, have like a 30-page list. Just have these 5,000 issues to discuss.
And it's thumb through it, or maybe don't lick your finger.
Okay, we're on page 4 now. Bear with me, let's see. So yeah, I mean, you got to make it brief, but to have that written down is always good, whether it's live or not live.
And speaking of written down, so we did have somebody in the Q&A part of the chat say that they were patiently and excitedly waiting for the new edition of Bill's Burnout book. Just throwing that out there as a common theme.
It's actually happening. So I think next year, it'll be out next year.
And in the meantime, people will be dealing with COVID-related diabetes burnout. And so you can add this whole chapter after the fact about what that was like and managing that. I mean, from the people that you're seeing, without breaking any kind of clinician clause, are you seeing a lot of people experiencing heightened levels of diabetes burnout as a result of all of this pandemic chaos? Or is it sort of at the same level?
it's at the same level. I'm not actually.
That's
I'm
interesting.
I'm kind of surprised, but I'm not. And it may be just because people are so worried about everything else,
Sure.
you know, but I'm really not. Actually, I've been really impressed that people I've met recently who are dealing with a lot of tough stuff, and it's no different though than before. It's really been surprising.
So what happens when this is over and people have been dealing with this for however many months that this goes on, and then your office is filled with people who are dealing with the after effects of trying to acutely manage something so intense during a pandemic? Then they're going to come rushing into your office with some version of, I mean, would it be called PTSD at that point?
Yeah. It's so lovely to think about that time, isn't it?
When it's over? Yeah.
Yeah. But I don't really care what's going to happen. It'll be great, you know, as long as we're in the after part of that. Um, I don't know what that's going to be like. I mean, how is our, you know, on the one hand, what we're seeing constantly, if people are saying, you know, nothing is ever going to be the same, right? Well, our healthcare is going to be different. Our relationships are going to be different. The economy is probably not going to come back for quite a while. We don't know. You know, our only odd model is what happened after the Spanish flu. And what happened after the Spanish flu is people didn't talk about it. Things went back to normal. And we had the Roaring 20s, which was awesome. So it was kind of, and women had the vote, by the way. So it was an amazing time. So we know, very broadly speaking, that in response to pandemics, we've actually seen huge societal improvements, huge improvements, going back 1,000 years and more. So that's the good side. But I don't have any idea. Is all this going to be forgotten? Are there going to be after effects? What's this going to be like for people? Is it going to be good or bad? I just want us to get through it. I look forward to having after effects. That would be awesome to have after effects. Please, let's have after effects.
Exactly. And we are, sorry, just checking. There's some references in the chat to the superhero power of people with diabetes dealing with something invisible. So we're kind of coming full circle with that.
Yeah.
But I like the idea that it's good to start with something like that, and also to finish this discussion with something like that, because it's the antithesis of the doom scroll. It's something that makes us feel empowered and powerful, and that is a rare bird in this particular time frame. So
yeah, if you're watching and you have diabetes, you should know that you're cooler than almost everybody else, because you're in many ways more prepared than everybody else, because you have learned that you need to be paying attention to something invisible and addressing it. And that's absolutely remarkable.
Well, I like that. And the sun has apparently gone out at my side of the country.
Tell.
Sorry, I got very doom and gloom over here as I'm like, end on a positive note. The lights went out. But we are super close to the end of our discussion. But was there anything else that you would want, not to make the big blanket statement of anything else you'd like to add, but before the world ends on my side of the country over here, is there anything else that you think that we've been missing in terms of managing diabetes during a pandemic? People concerned about all kinds of different things outside of diabetes, and just having a place to bring their concerns is a plus.
I'm getting ready to do a talk on this. So I was looking at my little list here over here on the side about other things that I was going to want to make sure I do when I have to do this talk. And, you know, I guess I would say I don't want to be too corny about this, but a lot of the things that I think we've tended to talk about are the concerns for people who are actually doing relatively well. And when we think about how many people are struggling with deeper poverty and food insecurity, and if you're not one of them, then remind yourself how lucky you are and think about how you can be of help to those who need it. But there's a lot of people doing very poorly, and a lot of our first world concerns are first world concerns. So that's all. I guess I just wanted to mention that, and I like the stuff we've talked about. It's helped me to think about this more, especially this idea of what are some of the life affirming activities that you can bring about into your life now as we continue to wait out this crazy process.
So it kind of brings us back to the giving back part. I like focusing on that, finding people that you can help. And there are a lot of people who might be watching here saying, well, I'm not sure how I can be of assistance to anyone, but just listening to someone's concerns can be what they're looking for in that moment, at least as a starting point.
Yeah, and like we said, is there someone who's lonely in your neighborhood?
Mm-hmm.
If you have an extra dollar, give it to a food bank. I mean,
Mm-hmm.
throw your tomatoes over the fence. I mean,
Gently.
it's an isolating time for so many folks. So, any way you can safely reach out to others is going to be just a blessing.
Well, I love that. Thank you, Bill, for being part of today's chat and reaching out to me. I will send you a tomato as way of payment. I hope you appreciate it. They are hard-earned. What's that?
I'll send you one right back too.
Oh, it better be like super nice and fresh. And and I wanted to remind everybody that you can visit Bill's website, the Behavioral Diabetes Institute, online. So is that behavioraldiabetes.org?
It is. Oh, you remind me of something else I wanted to mention.
Yeah, shoot.
Because this has come up recently. So as therapists, most of us are exclusively virtual these days, but I've been getting our institute's been getting a lot of calls recently. And I just want to mention, we're really constrained by state licensure requirements. So if you're looking for a licensed therapist, odds are pretty good it needs to be someone who is licensed in your state. And I bring that up just very selfishly because we get getting calls from people who I wish I could help, but because they're not in California, I'm prohibited from providing the help I want, which I have to say is very frustrating for me because we would like to be able to do more.
Sure.
So just be forewarned about that, that's all. And there's a lot of cool people everywhere. So if you're looking for mental health assistance, you should know that there is a mental health and diabetes registry. You can find it at the American Diabetes Association website, ada.org.
Diabetes.org.
Diabetes.org. See, don't listen to me.
The ADA one takes you to the dentist. So
yeah, and there are mental health professionals who know enough about diabetes everywhere. So you can look them up that way.
Excellent. And I hope people do. I hope people who are struggling in any way reach out and get that help. It's very important.
Okay. Thank you for the nice chat message that I'm occasionally looking at, but trying to pay attention to you. All right. Well, Kerri, you be well, and you continue to be a gift to everybody as you are. So.
Oh, and you as well. Thanks for jumping on with us. And for everybody at home, we're going to be doing our next Screenside Chat on August 23rd, and we're going to be talking about COVID and going back to school with Crystal Woodward from ADA. So we hope you guys are able to join us then. And Bill, thank you for joining us today. It is always a pleasure.
Okay. Thank you, everybody.
Talk to you soon. Bye, everybody.
Bye.